For performing retinoscopy, we require trial case, a target and a retinoscope. We ask the patient to fixate at a distance target so that the accommodation of the patient's eye relaxes. The procedure is performed at an arm distance, known as the working distance, and the conversion of this working distance into diopters will give us the power of the working lens. Now, we check for the movement of the reflex, vertically as well as horizontally. If the movement observed both horizontally as well as vertically is a with movement, that is, the pupillary reflex moves along with the streak of the retinoscope. We neutralize this type of reflex with the plus lens. This type of reflex is seen in an emmetropic eye, hyperopic eye and a myopic eye which has an error less than that of the working distance. In an emmetropic eye, the light rays emerging out of the eye are parallel to each other and the examiner projects the image of F1 and F2 and hence the movement is seen along the movement of the plane mirror, that is, the with movement. In an hyperopic eye, the light rays emerging out of the eye are divergent. So, the examiner projects the image of F1 and F2 and hence the movement is seen along that of the plane mirror, that is, with movement. In myopia, less than 1 diopter, the light rays emerging out of the eye are convergent and meet at a point F1 and F2 behind the observer sitting at 1 meter. The movement is along that of the plane mirror, that is, with movement. Sometimes we notice a neutral reflex. No movement is seen. That means the patient has an error equivalent to that of the working lens. Rays emerging out of the patient's eye are convergent and meet at a point 1 meter at the pupillary plane of the observer and hence no movement is seen. Now, if the movement observed both horizontally and vertically is an against movement, that is, the pupillary reflex moves against the streak of the retinoscope, we neutralize such a reflex with a minus lens. This type of reflex is seen in myopia more than the working distance. The light rays emerging out of the patient's eye are convergent and meet at a point between the patient and the observer and hence the movement is opposite to that of the plane mirror, that is, against movement. This procedure, that is retinoscopy, gives us the gross value of the refractive error of the patient's eye. To get the net value, we deduct the gross value from that of the working lens. For an astigmatic eye, we can determine and refine the axis using a the break phenomenon. When we keep the streak at 90, the pupillary reflex sometimes is seen obliquely, that is, the axis is present. The procedure is to align the streak along with the pupillary reflex. To confirm the axis is correct or not, we perform a technique known as skewing. In this, we move the streak and hence observe the pupillary reflex. If the pupillary reflex moves against the streak movement, the axis determined is wrong. If the pupillary reflex moves along with the streak of the retinoscope, the axis determined is correct. Straddling is a technique which is performed after refraction. This technique helps us in the refinement of the cylindrical axis. We move the streak 45 degrees on both sides, that is, clockwise and anti-clockwise to the cylindrical axis of the trial lens. We observe thickness of the streaks on both sides. If the streak is thick at one side and thin at one side, then we move the cylindrical axis of the trial lens towards the thinner side by 5 to 10 degrees and repeat the procedure until we achieve the same thickness and brightness on both sides, as equal thickness and brightness will give us the correct axis.